Hi, if you're here to talk about your new Trulicity prescription, that must mean that you have type 2 diabetes. So, before we can jump into all the ins and outs of Trulicity, let's take a step back and break down what that really means for you. Type 2 diabetes is a combination of two things. First, the insulin in your body isn't working properly, and two, your pancreas isn't producing enough insulin. Insulin's like a key, opening the door from your blood vessels to the cells to let the glucose through. When your insulin isn't working properly with the receptor, it's like trying to use your car key to open your front door. Not exactly the results you want. Because of this, you become hyperglycemic or your blood sugar starts to raise. And then your pancreas is going to start pushing out more insulin to try to lower it and get it under control. The problem with this is your body can't keep up with all this added workload. Your pancreas gets tired and you start producing less insulin. Because of that, your blood sugar raises even higher. There's a couple things you can do to help this before you turn to medication. You could start eating a healthier, low carb diet and getting up and exercising every single day. Now, while these things are super important, sometimes they're not enough, and that's where Trulicity comes in. Trulicity is a glucagon-like peptide 1 agonist. Now, what does this mean? It means that it works in your pancreas to stimulate the receptors responsible for insulin production and increase the amount of insulin that's being pumped out into your body when your blood sugar is high. But remember, just because you're taking medication to produce insulin doesn't mean that you can stop eating a healthy low carb diet and exercising every single day. This isn't a cure. There's no cure for diabetes. The best thing you can do is use all of these things in conjunction to give you the best overall health. Now let's talk about dosing and how to take Trulicity. Trulicity is a subcutaneous injection. So what that means is you're injecting the layer of fat directly under your skin with a short needle. When you're looking for injection sites, you want to find areas of the body that are fatty that you can grab that fat in between your fingers. A great example of this is the back of your arm. So what I want you to do is hold your arm out, roll up your sleeve. You see that little bit of fat that hangs under your bicep? Take your other hand, just like that, and pinch an inch or two of that in between your fingers and feel it for a second. That's what one of your injection sites should feel like. Some other good spots are the front outside of your thigh, your upper hip, and the bottom half of your abdomen, as long as you're staying 2 inches away from your belly button. You should rotate these spots weekly to avoid irritation. Now, dosing starts usually at 0.75 milligrams weekly, but can go all the way up to 1.5 milligrams. If you miss a dose of Trulicity, you need to take it as soon as you remember, as long as your next scheduled dose isn't within 3 days. Once you're within that 3-day mark, you just need to skip the dose and wait till your next scheduled one. But remember, it's really important to make sure you're taking these every week as directed to control your blood glucose level. If you're already on insulin therapy, your doctor may lower the amount of insulin that you're taking while you're taking Trulicity. That's because your insulin levels can get too high when you're taking these two together, and they can actually do their job too well. And that would cause you to be hypoglycemic or low blood sugar. Signs to look out for that are sweating, dizziness, and trembling. And make sure you're not combining the two into one injection. They need to be given in 2 different needles. You can use the same injection site as long as you're not administering them directly next to each other. Now let's talk about side effects. All medications have them, but it's important to know the difference between which ones are just annoying but tolerable and which ones you should call your doctor immediately about. Some common side effects of Trulicity are stomach pain, diarrhea, and loss of appetite. And while none of these are particularly enjoyable, they're not anything to worry about, and for most people, they go away pretty quickly. However, if you start experiencing any of the following side effects, you should call your doctor immediately. Nausea and vomiting, shortness of breath, sweating and confusion, irritability, fast heart rate, trouble swallowing, or swelling or lumps in your neck. Trulicity can cause thyroid cell tumors, so people with multiple endocrine neoplasia syndrome type 2 should try different forms of medication. And because of this, it's very important that when you're taking Trulicity, you be on the lookout for these things: lumps or masses in your neck, trouble breathing or swallowing, or hoarse throat. If you have any of these, you should contact your doctor immediately. The first step to helping your type 2 diabetes is knowing what your body needs and why you need it. And remember, you know your body better than anyone else. So if something doesn't feel right, it probably isn't. If you have any questions or concerns while taking Trulicity, do not hesitate to reach out to your doctor. That's what they're there for.